Traditional clinical weight loss interventions can be costly, time-consuming, and inaccessible to low-income populations and people without adequate health insurance. Today's guest, Dr. Gary Bennett, has developed an Interactive Obesity Treatment Approach, or iOTA for short, that represents a real advance in this area. Dr. Bennett is professor of psychology and neuroscience, medicine, and global health at Duke University, where he's also dean of Trinity College of Arts and Sciences. Welcome to Leading Voices in Food. I'm Kelly Brownell, Director Emeritus of the World Food Policy Center and Professor Emeritus of Public Policy at Duke University. Gary, thanks so much for being with us today. I'm really eager to talk to you.
Oh, it's my great pleasure, and I appreciate the invitation.
Well, you know, in this time when people are talking about more expensive and kind of more intrusive interventions like the big weight loss drugs, it's nice to know that there may be alternatives that could be accessible to more people. So could we start off with you telling our listeners what the iOTA approach is and how it works?
Sure. So simply, this is an approach for weight management. It's useful for weight loss or preventing weight gain or maintaining one's weight after you've lost weight. And the idea here is that it's a technology that's designed to be highly accessible, useful for a range of different types of populations. So as you described, we have developed and tested this primarily for folks who are medically vulnerable, who are low income, who are racial ethnic minority, who live in rural communities, where we have traditionally had real difficulty reaching populations with effective weight loss tools. So iOTA is a fully digital approach. It uses technologies like smartphone apps, but it can also use text messaging, interactive voice response. Those are like robocalls, automated telephone calls. Websites, we've tested this on a wide range of different types of technology platforms. And we've tested it in a range of different types of populations all over the country, and indeed even in other countries.
So give us some examples of what kind of information people might be receiving through these various forms of media.
The underlying kind of technology, the underlying approach, I should say, for iOTA is actually reasonably simple. It operates from the perspective that creating weight loss is really about making an energy deficit. That is to say, helping people to consume fewer calories than they are expending. And the realization we had years ago was that you can get there, you can create that calorie deficit in a whole host of different ways. Some people diet, some people try to get more active, there are limitations around that kind of approach. But fundamentally, you can also just get there by asking people to do some reasonably straightforward behaviors, like not consuming sugary beverages or consuming fewer chips, cookies, and candies, or changing the amount of red meat that they put on the plate. And if you frame those things out as goals, then you can prescribe those goals to people in ways that make sense to them personally. The trick, though, is actually in the idea of personalizing those goals to the given individual. And that's where technology comes in and gets very helpful. The case is if you have a large library of these goals, you'd want to try to provide these in a highly personalized way that really are aligned with what people's needs are, noting that those needs may change over time. And so what we do with iOTA is that we deliver a very short survey. That survey then helps us to be able to look into our library of goals and pick the ones that are most useful for our users. Then we prescribe those goals, and then we ask folks to self-monitor those goals. Self-monitoring that or tracking is an extraordinarily powerful part of behavior change science. And so we ask them to track using one of our technologies, the chatbot or the text message or the interactive voice response or the smartphone app. And then every time that we receive data from one of our users, we give them highly personalized feedback that is designed around principles of behavior change science. And then over time, we also give them support. And we do support sometimes from a coach or sometimes from a layperson. Sometimes it's even from a physician. And over time, what we find is that this kind of an iOTA approach helps people to lose weight, prevent weight gain, have weight loss maintenance. But it also has a cascade of other types of effects, some of which we didn't really even anticipate producing.
This reminds me of something that I've fought for years, that nutrition and weight control can get incredibly complicated and down in the weeds in a fascinating way from an academic point of view, but that you can get to the goal line with just a few simple things. You might be 80% to the goal line just by eating less junk food and eating more fruits and vegetables. And getting mired in that last 20% becomes confusing. And it sounds like that's exactly what you're doing, that you're trying to pick some of the big things that people can do, establish goals around them, and then provide a behavioral path for getting to those goals.
That's precisely our thinking. And the thing I'd add to that is part of the challenge in weight control is making those types of changes for long amount of time that it takes to produce and sustain weight losses. And one of the things we know is that any kind of behavior change, but particularly behavior change for weight control purposes, just requires an extraordinary amount of engagement over a very, very long time. So I'm fond of saying to our teams and to others, I'm really much less concerned with strategies that produce weight changes at a month or 2 months, because the real question for us is how do we create technologies that can support users as they enter the 10th month or the 12th month? Fundamentally, what we're really after here is not really weight loss, but it's really the changes in a whole range of health parameters. So cardiometabolic function, indicators of the development of various cancers, diabetes parameters, those kinds of things. And it takes time and effort to produce those changes via the weight control changes that we're hoping to produce with these technologies.
So what kind of results are you getting from this? And does the iOTA program, in fact, make it easier for people to stay on track with their health goals?
Yeah, it's a really interesting findings over, more than a half dozen trials in the last bunch of years. If I were to summarize, I'd say we get pretty modest weight losses relative to, say, what you might get with a very intensive weight loss intervention or with a drug or certainly with surgery. But what's different is that those weight changes do tend to be sustained over time. So they're modest, but they last. And the really interesting finding for us is that people stay very engaged with these technologies. So, on average, people tend to use new apps pretty feverishly in the first month after they download it or they put it on their phone one way or another. And then most people, about 70% of the time, people move away from those apps. They disengage. When we look back about a year after people have started using iOTA, it's very, very common for people to be engaged with our technologies 85% of the time. That is to say, they're still tracking their goals at about 80% fidelity after a year. And that's really terrific. And it's one of the reasons I think that we're able to see sustained losses, even though those losses aren't very large. And again, my goal here is much less, this is a public health approach. I'm much less interested here in trying to produce large weight losses for cosmetic reasons and those kinds of things. This is really an effort to try to create a very highly disseminable, inexpensive treatment that is accessible to large numbers of folks. In trials, we certainly have seen changes in blood pressure and various cardiometabolic parameters like lipids. Those changes tend to be larger in certain populations. When we tested this in China, we saw very, very large dips in lipids. And those also tend to be sustained. The biggest surprise for us over the years has been a relatively consistent set of findings that suggest that people have improved well-being on the back end of participating in one of these kinds of treatments. They tend to feel less stressed, have more energy, have better quality of life. In fact, we've seen very, very large reductions in depressive symptoms in study after study. I'll just add tangentially, that's notable for us in the populations in which we work, because these are not populations for whom weight is very closely tied with one's emotional state. That is to say, the patient populations in which we work tend to have more tolerance for heavier body weights compared to other populations. So when we see weight loss in our trials, we don't often expect to see that accompanied by improvements in depressive symptoms, but we see it in study after study after study. So we've been really pleased with this broad array of impacts that this technology seems to produce.
It's nice to hear the positive results. And I also like your aspirations, because a smaller weight loss, better maintained, is a much better outcome than a larger weight loss regained, which is typically the case. And the fact that you're getting these corollary effects in other areas of life, like mental health and things like that, is very impressive. Are there stories you could tell from people that have been on the program that might be illustrative?
Oh, yeah. What happens most often in our studies is that at some point, one of our patients will approach me and say, I've tried everything. I've tried dieting, tried this app and that app, and this is just so easy. I've been able to stick with it for a long time. And that happens a lot. And it always pleases me greatly, because, at the end of the day, we're really trying to create these technologies for real people to use over a very, very long period of time. I find that exciting. We've had a number of people over the years who have gotten off their hypertension medications or have seen changes in their diabetes, their A1Cs as a measure of diabetes. And it's just really exciting. And it's one of the things that I think gets us up in the morning to do this work.
That is exciting. How has it been especially influential among people who otherwise have limited access to care?
We really started this work because of a series of observations that I made early in my career when I started working in community health centers. So community health centers are often primary care units that are in many major metropolitan areas, often in rural settings as well. And their primary intention is to serve patients who are medically vulnerable, often patients who are poor. And in those settings, the providers in those settings are just doing extraordinary work. And I started to spend time there and was trying to understand how we might think about situating this kind of technology and these kinds of public health style interventions within those care settings. And the observation I made over and over and over again was that even in these care settings that are really designed to serve patients who have low income or come from limited income backgrounds, weight control, behavior change in general was just not the highest priority. These physicians are dealing with all manner of acute and chronic health crises, and they just didn't feel like managing a patient's weight was the best use of their limited clinical time and attention. The challenge of that, of course, is that for patients who have obesity, that can be a primary cause of many of the acute and chronic conditions that my physician colleagues were treating. And so what I began to observe was that, patients who have the greatest need for comprehensive obesity care are often the least likely to receive it. And this is borne out by national data, which suggests that if you're a person from a medically vulnerable background and you have obesity, you're dramatically less likely to receive high quality care from the health system. And then there are a whole range of financial constraints that limit your ability to be able to acquire that care in the commercial market. And so there are really many, many people, really tens of millions of folks out there without options. So that's really why we started developing these tools. And I'm very pleased to say that the underlying approach that we developed with iOTA, it has been leveraged in a variety of weight control interventions that are being used in other places. The next frontier for us is to really think about how to disseminate this in a more widely accessible way. We've begun having conversations with metropolitan areas, cities that are health departments are thinking about doing these kinds of things. Some of these technologies have found their ways into other systems. And increasingly, as we have begun to test these approaches in clinical care settings, we certainly have seen ongoing use of these technologies in the community health centers where we originally came up with some of these ideas. So much more work there to be done, but I'm hopeful.
Do you see a role for this approach in conjunction with or as a companion to the weight loss medications that are getting so much attention now?
Yes, I do. One of the things that's notable about this generation of weight loss medications is that they do not have an indication that they should be accompanied with a behavior change intervention. So the other way to say that is that most weight loss drugs that we've seen in years past have received FDA approval contingent on their combination, their use alongside a behavior change intervention. And the GLPs, the ones that are most recently emerged, don't have that indication. Nevertheless, we know a couple of things. One is that these are medications that are designed to be used for a very long time in order for that weight loss to be sustained. And there are a number of people who increasingly are interested in transitioning off of these medications and beginning to engage weight control on their own. So my sense is that technologies like iOTA can be very useful in helping people make those transitions off of drug. I think the technologies we've created can be very, very useful as an adjunct to try to help to maintain motivation for weight loss and to think about addressing some of the related behaviors that can help people to experience an overall improvements in their health. So becoming more physically active and making changes in stress and well-being as an adjunct to the weight loss that's being produced by the drugs. I have to tell you, I'm very, very concerned about the cost of these medications. I'm very pleased by their efficacy. I'm extraordinarily concerned about their cost and their limited accessibility. I expect that will change. But during this period of time, I'm very concerned about the creation of additional disparities in patients' ability to seek really high quality care.
Yes, I'm glad you raised that point. So where do you see the work going next with iOTA?
Well, I see it going in two directions. One is we are thinking about dissemination. Where can you embed this kind of approach inexpensively in ways that allow the most number of users? The emergence of artificial intelligence technologies, notably the large language models, really help in that regard because they allow us to deliver that kind of core iOTA special sauce more flexibly in a range of different technologies and even more inexpensively than we can do right now. iOTA is extremely cost effective, and with AI delivery, could be even more so. And then the other path I see is really what you asked before. It's how do we think about using these technologies as an adjunct to medication treatment, which I think will become even more common over the next couple of years. I hope that it becomes a more common approach that's used to treat the patients who have the highest risk of obesity and all of the chronic health conditions that travel along with it.
Well, Gary, this has been a very exciting conversation. It's such admirable goals you have, making these technologies available to the maximum number of people, especially those in greatest need, while evaluating them and approaching them in a scientifically rigorous way. So congratulations for doing really important work. And I'm so grateful you could join us today.
Oh, the pleasure is mine. And it's always wonderful to talk to you as a person whose work has inspired my own.
Oh, well, thanks, Gary. So today's guest is Dr. Gary Bennett from Duke University. And thank you for listening. And thanks especially to Deborah Hill for her fine work in producing this series. If you'd like to subscribe to the Leading Voices in Food podcast series, you can find it on Apple Podcasts, Google Podcasts, or your favorite podcast app. Podcasts and transcripts are also available on the website of the Duke World Food Policy Center. This is Kelly Brownell.